Good morning to everyone. I'm so excited to share with you today, again, as Ricky mentioned, our first masterclass session. But before I go any further, I really want to talk about what is a masterclass. It's an immersive, experience-driven session led by a true subject matter expert who doesn't just present information. They show us how we think, decide, and perform in real solutions. Unlike a webinar, which is largely one-way information delivery, a masterclass is interactive, where you engage directly with the expert, you can ask questions, and work through real scenarios together. You're not just learning what to do, you're learning how an expert does it, gaining insight into their mindset, shortcuts, and hard-won lessons that no slide deck can capture. Think of it less like a lecture and more like being in the room with a coach. The goal is for you to leave not just informed, but genuinely transformed in how you approach the subject. I'm excited that we're sharing this space not only with the 8 counties, but it is our intent also to be able to share this across the state of California, because it's all in service to building a kin first culture. The title today is Making the First Placement the Final Placement. And again, with the masterclass, here are the questions I want you to ask yourself. Are we placing children, or are we just moving them? Mm-hmm. Is kinship care truly a priority or a convenient checkbox? And what would it actually take to get it right the first time? And when I think about these questions, and when we think about the importance of kin, the first person that comes to mind is our expert of today, Dr. Sharon McDaniel, who is the founding president and CEO of A Second Chance, Inc. It's a leading nonprofit voice in kinship care. Dr. McDaniel has over 40 years of professional experience as an award-winning child welfare leader in Pennsylvania. Some of her notable affiliations include being a trustee for Casey Family Programs. In 2024, Dr. McDaniel was appointed to the board of directors of the Eaton Hall Foundation in Pittsburgh, and a former trustee of the Jim Casey Youth Opportunity Initiative with the Annie E. Casey Foundation. Civically, she is the former president of the Black Administrators in Child Welfare and founder and co-curator of the National Sankofa Institute for Senior and Emerging African American Child Welfare Leaders, founder and current president of the African American Strategic Partnership. Dr. McDaniel has authored so many articles, papers on child welfare, and has numerous local and national honors and awards. She is a sought-after lecturer, where she has presented at the University of Barcelona, Oxford University, Howard University, and others. I am also proud to say she's not just a national expert, she's not just a colleague, but she's also a friend and mentor to myself. So today, I would like to welcome you to our masterclass expert, Dr. Sharon McDaniel.
Thank you, Robert, so much. My goodness, I need to pay you for that introduction. I don't know.
Well, we appreciate you just sharing this space with us, Dr. McDaniel. And if you don't mind, we're just going to jump right in.
Absolutely.
Okay. Dr. McDaniel, before you were a CEO, you were a child in this system. When you hear our title today, First Placement, with kin will be the last placement. How does that land with you, and what creates the urgency for you in this moment?
You know, it gives me joy when I hear that will be the first placement and the only placement, because as we think about, we hear this notion of a trauma-informed lens, but yet our practice and our behavior induces trauma. We're placing children from place to place to place, and then we're wondering why they're emoting and having various issues. So when I think about my experience, I didn't have multiple placements. I don't have the story about the horrific being moved from place to place, because I was placed with my grandmother, and and then within the family, I had a second placement because I was a wayward teenager. I had to just always ask why, and so when people get old, they don't want to understand why. So anyway, I wanted to move with my auntie because they were younger, but anywho, I was in one family, so I didn't have multiple placements. And that family, my family said, you're here and you're here forever. And so I was always thinking about that forever home. So when we think about first placement, only placement, that is the forever home. And even when the young people go back, that is their forever home, because they were just at grandma's house the weekend, and now they're placed with grandma. So at the end of the day, it brings me great joy. It's what the system needs. And when we're talking about outcomes for children, we know that they have the best outcomes when they're placed with families. So I'm just delighted when I hear that. And I'm hoping that the systems in the across the nation, not only in California and pockets across this nation, that we're really moving to first placement, only placement.
Dr. McDaniel, we often have used or have heard the phrase talking about saving children. Did the system save you, or did you survive it? How does your own journey inform the way a Second Chance Inc. treats a grandmother or a caregiver who talks through the doors versus how a typical county agency treats her?
This whole notion of savior, that savior mentality, I think that unfortunately, child welfare, the way in which we're trained in systems, it's that savior, complex savior mentality. The system didn't save me. My family stepped up and said, we are going to deal with the family crisis. My mom died when I was 2. My father made a decision that he would have his 3 children with his family because he was a young parent. So at the end of the day, the family did what they always do. They step up and they ensure that they wrap supports around my siblings and I. So this notion of savior, what does that really mean? And why do we have this complex about savior? I think what we do, the system, we like to pathologize families. Something's wrong, and our universities teach us something's wrong. We must fix them. And so I think when we then go into these systems, we think that family can't make a decision, so we have to save them. We have to tell them what to do instead of partnering with families. And so at the end of the day, for me, I made sure that when I started a second chance that we partner with families. We get the information from them. Why we have successful placements? Because we ask the family, well, where would you like your child placed while you're dealing with this crisis that families go through? And they decide. So at the outset, we're empowering them to make decisions for themselves and not saying that something's wrong with you. We have not pathologized them. We partner with them. So again, I'm just really delighted that we're having this conversation, Robert, because my heart is that we believe in empowering families. We talk about the triad because everybody has a voice. The child has a voice, the grandma has a voice, and the parents have the voice. The way we treat grandma is tell us what you need to make sure that you're equipped to handle your grandson. You haven't parented in a long time. So how do we support you in making sure that the organization is adhering to what you need? So no, it's not a one size fits all approach. Every grandma is different. So we have to ask that particular grandma, what do you need? Or auntie, uncle, whoever that caregiver is, what do you need to be successful? And that's what our model is. It's not a one size fits all. It's not a broad brush. It is individual. It's an individual opportunity for each family.
Dr. McDaniel, you said some interesting things here. You mentioned that there's not one size that fits all. You mentioned that every caregiver is different. And then I want to kind of hone in on where you said we should not be pathologizing
Apologizing. Hmm.
families. And so as we've worked across the country, we've often heard staff hesitate to place with kin because they believe intergenerational trauma is, guess what, contagious. They think that grandma or any caregiver who raised the parent who abused the child, they too must be unsafe to place the child with. How do you respond to the accusation that kinship care just recycles abuse?
Well, I first started about looking at our own family, right? We all have some challenging, things that have happened in our families. So do we indict the entire family because something happened? Life happens to people, right? And how people choose to deal with, trauma, loss, whatever the situation may be. And when we look at data, we know more children come into care because of neglect, not physical or sexual abuse. So there really is something around obviously poverty, obviously around mental health, and being under-resourced in communities. And so we understand that as a context and grounding that at the beginning, then we have to understand that where's the apple? right? I say people to people that the apple has fallen. It is now apple juice and it's good for the soul. So that's what I say to people. It's like really, we have to stop this again. And that goes back to pathologizing families. Something must be wrong. Something must be wrong with grandma. Therefore, it's wrong with the daughter. Then it'll be wrong with the grandchild, the offspring. There's nothing wrong. Family dynamics happen every time. And again, I ask our audience just to interrogate their own families. Look in your own lives. Would you want the system making a decision because something happened in your family? So we have to really understand and ground it with, if it were me, the standard of my own. And I often say I ask systems, if you were in the system, are you satisfied with the service that you're delivering? Are you satisfied with the way in which you approach families? And if you're not, then you need to shift. You need to think about what you're doing, because if you would not want to be a part of this system, why do you think other families do?
Wow. It's interesting that how you put it back for us to kind of take a reflection on self. For instance, are we satisfied with how the system operates? And
Yes,
in terms of how we may pass judgment on families, think of our own families. Think of the issues that we have within our own families. And when we consider those things, we might just have a different level of empathy or just a different way to engage to say,
that's right.
we know that there are issues that come up in families because there are issues in my families. However, I love how you said it doesn't mean that we should indict the
That's right.
entire family, because I think that's something that we see happening. For instance, you may have the Smiths come up as a case, and then this is a case that's been going on for decades, and the workers all know, oh, we're dealing with the Smiths family again. And when they're taking that mindset, potentially, whether they know it or not, it's that bias to say, I'm not even willing to engage in a conversation.
Mhm.
Can you talk a little bit about how that might in any way just impact the child who we should be considering from being placed
Right.
in?
You know what? Maya Angelou says, when we know better, we ought to do better, right? And so the bottom line is that, it might be that next generation, that young person says, I want to break the cycle. So just because the other Smiths, the six Smiths before, the seven Smiths, had some challenges, it does not mean that that next person cannot say, I want to break the cycle in my family, whatever that cycle is. It could be alcoholism, it could be poverty, it could be whatever. And that you have to assess that next generation on its own. Every person needs to be evaluated on their own in terms of their background, not based on the history of the family. Because again, I go back to, if we take a look see and look under the rug, peel back the onion, whatever you want to call it, in our own families, we find some things there, right? Do I want to be indicted? Say I can never be a social worker. I can never show up in a child serving organization. Absolutely not. What we need to understand, life happens to people every day, and choices are made by one, people around you. Who's helping you make those choices? Who's helping you negotiate those choices, right? And so when we think about it, I just want us to center humanity. At the end of the day, I said this work is about human beings. How do we center humanity? There's something about when we get in these roles and we get some power, it's like all of a sudden we forget humanity. No, no, no. If it were me, the standard of my own, I want someone to treat me with the dignity and respect that I deserve, treat me with, as a human being, hear my voice, hear my circumstances, right? And then understanding that, listen, how do you help me negotiate this? Not indict me, but support me.
Interesting, Dr. McDaniel, how this segues into another question, as staff sometimes do. Indict families because of past family history, past family trauma. Workers often mention there's a fear at times. As an example, if a child is hurt in a foster home, they call it a tragedy.
Mhm.
If a child is hurt in a kinship home, it's a headline and someone gets fired, someone gets blamed. How do you speak to the fear of liability that sometimes paralyzes decision making? Is the risk of leaving a child with a stranger greater than the risk of an imperfect kinship placement?
So this is where data is really, really important. I wonder if the audience knows that there are more children who die in traditional foster care than in kinship, more children who are harmed in foster care than in kinship. So I think if people would look at their own data, where's the fear? False evidence appearing real? Where is the fear? Right? And so we have to be able to educate our own systems about, let us look at the data. How many young people were actually harmed in kinship care? And then compare that to traditional foster care. And so at the end of the day, whether it's foster care or kinship care, an assessment is critical. Not all kinship families are created equal. There are some people we also know in our family, well, so and so, they'll be a good driver, but we're not going to place them there, right? So we already know in our own families who's kosher and who's not. Now, come on now. And it's the same thing with if we do that with our own families, so does the kinship family. They'll say, if you're doing family meetings, okay, Uncle so and so can be the basketball coach, so and so can do. They make decisions based on their own family history. So they already know. So we have to recognize that we have to do assessments. What we want to do is place a child without an assessment. And then when something happens, I go back to, where was your assessment? Where was your assessment? All kin are not created equal, just like all foster parents are not. So they can play a role, but they might not be the primary caregiver. And we have to understand that.
I love when you mentioned around centering data because in doing this work for so many years, I've heard from countless number of staff who do have that liability of fear. They fear based on there's been a family where there's been just, cycles of abuse and neglect. And if they wanted to make a decision, even to have the family's voice heard in those child family team meetings, and if there's a family that kind of steps up because of some of the information that's been passed through in all of our child information systems, they're like, I don't think we should be doing that because every time we've done it, it's shown where this family has just dropped the ball versus, as you just mentioned, listening to family voice. But something that we haven't really talked a lot about is identifying family strengths. Can you talk a
Yeah.
little bit about that?
Yeah, you know what, Robert, you said something really good that I think people need to hear. When I aged out of the system, I was able to go many, many years ago, decades ago. I asked to see my records. The way in which caseworkers describe me, just because I was always asking why, the belligerent, that I mean, the way I was described in my record, are you kidding me? And this is what we do to families. We describe them in a certain way because the way they make us feel, it's not even accurate. But we describe them in these very negative terms. So the next worker that gets it, oh, they're reading the prior worker's work. So we're already creating a bias for that family, just the way we're describing them in the records. I wonder if we describe them to say the strengths of the family, what we saw was this. Some of the opportunities that we'll work on. So you see how I say opportunities, not a deficit-based language. So we got to think about the fact that we need to switch our language to strength-based language and not deficit-based language. Again, the standard of our own. Will we want our situations to be described as in a negative way? So how do we reframe that? How do we create a new narrative around strengthening families through strength-based language? Right? Understanding that there are some challenges and some issues, but also talk about challenges as opportunities. So the opportunity that I see with this family is that we could do X, Y, and Z. When I asked the family this, what they said was, I would need support. And there's the opportunity for us to connect them to resources. That's a very different engagement. And when families hear us talk that way, they want to be a part of doing something great. They want to be a part of getting their children back. But when you're saying, oh, you're just nothing but a drug addict, you don't show up, like, what? You've not empowered me. You've deflated me. I'm already at the lowest level because I don't care what you say. When families lose their children, they are at the lowest level. We have to understand depression sits in. So sometimes when they're not motivated, why don't we look at it through that lens of depression? How do we help them? But we help them by creating different narratives, different language.
Thank you, Dr. McDaniel. You just mentioned actually some really concrete things that I think we can take from this actually and incorporate it into some of the work. Strength-based language. not deficit based, right? Because as you mentioned, when people and parents do come to the attention of child welfare, they are naturally just, you know, high levels of stress, high levels of
Yes.
anxiety, and we might have an expectation that, you should probably act a certain way, not thinking you put yourself in their shoes, you're going to come to the table kind of a little heightened as well.
Right.
And then you mentioned challenges as opportunities, because I have been in child and family team meetings where we just talking about you didn't do this, you didn't do this, you didn't do this, and you didn't do this, without going to the next stage of it to say, hey, how can we look at this as something we can shift in terms of a opportunity too? And how can I, as your caseworker, support you in doing that? I think that totally shifts the paradigm of how you actually work with the family.
That's right. That's right. Think about this. How many of us, I've done case plans. I was a caseworker. I left the child welfare agency after not, almost 10 years. I left as an administrator, but I remember doing case plans. We give them 15 things to do. We give families 15 things to do across town. They don't have a car. So think about when we're having our meetings, if we could say, you know what, while you didn't do all 15, you did 11 and we're proud of you. Now let's figure out, excuse me, what we have to do to work on the other four, because it might be that we have to see if there's resources closer to where the family lives. So think about how many of us would be able to walk through and go through our own case plans that we write. That's always interesting. Would I be able to handle and manage all of that? Probably not.
You just brought up another one. I mean, and these are very critical, concrete practice things that, let's just say, I'm going to use your number, an exhaustive list of 15 things for the family to follow up on within their case plan, treatment plan, whatever kind of plan we want to call it. How many of us realistically could do it even within the time frame that the county asked us to do it, right? And I am trying to raise 2 or 3 kids and trying to ensure that I show up and meet the department standards. Let's not forget, I need to show up to make sure I'm meeting the court's standards
Yes.
and everyone else I got to work with. And so part of what I'm hearing is that, we sometimes can overwhelm families if we don't help. Even if, let's say, if there are 15 things we need families to do, how about prioritizing what's
Yes.
step one?
Hmm.
Instead of saying, hey, I'm gonna give you a case plan, here are all the 15 things, I need you to do them within X amount of time.
That's right. That's exactly right. And, create that, everyone, even when we're working, I'm looking to my supervisor, I'm looking to say, am I doing a good job? You get some evaluation, you get some positive feedback. How do we give families that positive feedback? As I said earlier, it's so great that you were able to do that. What would you like to work on? Building that plan together. I always say that things happen better when they happen through you than to you. So
I love
when it's happening with me, I'm going to, really do well because you've heard my voice. You didn't make me invisible. You see me. You see my humanity.
Thank you, Dr. McDaniel. I have maybe 1 or 2 more questions. And for those who are participating and tuning in, please get your questions ready. We want to open the floor in just a second for you to be able to ask those questions and have Dr. McDaniel respond. Um, Dr. McDaniel, I'm very familiar with you and your agency at Second Chance Inc. and your framework, your values, and the principles that you stand on. As we work with the counties here in California, how do you train your staff to unlearn the bias against poor families and Black and Brown families? How do you police their bias in your own workspace?
Well, for us, and thank you for that great question, but for us, it starts at the interview process. We have them go through a scenario to figure out and see how that employee responds to a real life situation. So I know that we're doing a lot with animation and things like that. We can actually build that in because at the end of the day, we want people in our employ that really get it. We don't want to harm. I always tell folks, I didn't create a second chance to make families worse off, but better off. And so that framing is that your partnership with this organization is to support families to be better off, and anything less is unacceptable. So anybody who knows me and works with me, they know I'm passionate about the work. I mean families to be better off. And so if that's not what you can do, then wrong organization. And so I set that at the outset. So it's very, very clear as a provider organization, I can do that. The other thing is around the training. We have our values plastered across the organization. So when you come in, you see what we value. And if you are working against that, we hold you accountable. Are you adhering to our values of dignity, respect, love, and honesty? That's how we treat our families based on those values. Every family has the right to be, to have that dignity, honored, valued, loved. Actually, we need to understand, we need to love what we do. You can't have to do this job and really act like you really want to support families. So it's really around centering those values. Every worker gets a card that they carry with them. They get a value card. We also have principles of values. So as an example, if a young person runs away, we look for them. We don't say, "Oh, they're gone, we're closing the case." We don't move kids in garbage bags. We don't move kids in garbage bags. Think about what that says to a young person, that everything that you own and everything that you value is not worth anything because I put it in your garbage bag. We have a luggage campaign that we keep luggage all the time around in our organization. Every worker carries a piece of luggage so that they can, if they have to, for some reason, if it's emergency, if the child has to be removed, they put the things in the luggage. So it's just sometimes those foundational values that really people get it. And so that's how we begin to center it. And again, we're also looking at alignment. Sometimes people get in and they find out they may not be in alignment. We have to make some decisions that it might not be the right fit for them in an organization. And we do that through evaluations and things like that. But we also give them training because the unlearning is the things that I've been told, my experiential learning, coming from different places, they may not have the values that we have. So we say to you, what do you have to unlearn? We also do bias training. So a part of, having real conversations and being authentic and transparency, what did you learn? How do you unlearn it? So we have ongoing training with our teams as well. So it's iterative and it's always.
One more thing, Dr. McDaniel, because I have had the pleasure of visiting your headquarters in Pittsburgh. And one of the things I found very fascinating around data, kind of taking us back a bit, is that you publicly publish your data across your organization, even down to the individual worker. What was the thinking behind that?
Excuse me. Thank you for that question too. And I'm sorry, I'm dealing with my sinuses, so sorry about that. Uh, we wanted people to be accountable. We wanted to build healthy competition because listen, everybody likes to compare themselves to like who's doing it well and not so much. But at the end of the day, the root of it is because every child deserves the respect to for a worker to make sure that they're in the right placement, that they're supported, and that triad, making sure we're giving grandma, auntie what they need, and getting children back home. So we publish time to permanency. We publish how many visits did you do that month. We publish your on-time rate for certification. Absolutely always, because we want to see how well we're doing. We are, for me, I'm like, I tell my county funders, you have a right to hold me accountable. You have a right and a responsibility to hold me accountable. And if I can't get it right, I don't need to be here. So for me, it's around making sure that the organization understands the standards. I didn't create this organization to make children and families worse off, but better off. A part of that better off is looking at our data and publishing it.
Last question, and then we'll open it up. With publishing that data, I can imagine there are at times workers who might not fully meet the performance metric. And how did you build the culture around where workers didn't feel as though, oh, the publishing or the public publishing of this data is not like a personal thing. It's not like a thing of showing where I'm deficient. But what type of data culture did you build in order for workers just to have the right mindset in that?
Because we kind of do a buddy system, and someone's at at the lower end, what they've been able to do, showing the data, they might go to that star performer and say, talk to me about your strategy. Because maybe my issue is time management. I don't understand how to do X, Y, and Z. So that really creates that buddy system so that someone who's it maybe at the top of, making sure all their paperwork is in and this person is struggling with, they'll be able to go to that person and say, give me some tips on how to do that. So it really creates not a culture of, yes, I want to do better, so people want to be able to understand where they are and then how they do better. So that teaming approach within our employee, the workers, to say, how do we help? And they do so willingly because nobody wants to see anybody at the bottom. And at the end of the day, when the worker's at the bottom, so is the family. So we have to make sure that we lift that family up. So that's the thing, is it's attaching that outcome to how the family and child, or how the family, the triad, is doing. And if that worker's not doing well, how can we suggest that that triad is doing well?
Love that. Um, Ricky, Dakota, Morgan, if you want to come off mute, if there are questions that some of our participants may have, opening the floor now.
Yeah, thank you so much, Robert and Dr. McDaniels. For those that I haven't met, I'm Morgan Cole. I'm a senior director at Think of Us, leading the Accelerator pilot in California. As Robert said, we'd love to open things up for questions now. Dr. McDaniel, I really appreciate that you've touched on a really nice mix of very concrete practice topics and tips and guidance, as well as some of the more big picture conceptual pieces. And similarly, we have a nice mixed audience here that includes county agency staff, community partners, kin caregivers, et cetera. So I would love for folks to put in the chat. We've already seen a couple come up, but what's coming up for you from your respective kind of vantage points, experiences, perspectives? What would you like to hear more about? What follow-up is this prompting from you? So feel free to put those in the chat and we'll voice those over as they come. To start us off, it looks like we've got a question here around how can we help youth connect to relatives and their culture so that they have lifelong connections to those they call family?
We just ask them. It's really interesting to me is that, as I travel across the country, we're still not talking to youth. We just talk to them. Like, who do you know? Where were you just at last week? Who's that family member that sent you that card? We just ask the youth. And we can start as very young. When I was a caseworker and a supervisor, I actually went through a art, sort of like an art therapy program, because I wanted to understand how to work with young people through art. So sometimes we just sit down and draw with the kids and have a conversation. I'm talking about the little ones. So we really have to center time as well. Like, we really can't do good casework, case management in 5 minutes. It's not going to happen. So we know we have younger children. We're going out and having that visit. Let's make sure that we're going to be there for 2 hours. And I know someone said, well, my caseload, but we have to make sure that we put that time in. But it's just really asking the young people in whatever way, through art, through conversation, taking the young person out to lunch. Young people want to talk and they want to tell you everything.
I appreciate that. So yeah, prioritizing it, making the time for it, using different methods of engaging youth depending on where they're at. Nice. Ricky, I'll turn it to you for the next one.
Absolutely. We had one of our partners ask a question, Terry. She wanted to know, you talked about this a little bit during your conversation, Dr. McDaniel, but maybe dive a bit deeper about how workers can address the bias that is often in the system regarding kinship caregivers, and how can we truly be a family and child well-being system versus just a child welfare system.
So it's not at the worker level, it's at every level. It has to be embedded in the system, and it has to be in the ethos of the organization. It can't be the worker, because if the system is such, the worker won't last if the system is pushing against that bias. But if there's no checks and balances within the system, biases continue. So it has to be at every level of the organization. So as an example, people know where I stand. I'm unrelenting and unequivocal about kinship at all costs. If someone wants to come in and say we're talking about foster care, wrong organization, you won't last long. So it really has to be within the ethos. It has to, you have to live and breathe it. And everybody has to have that check and balance. So from the top to the bottom, from the bottom up to the top, everywhere and in between, it has to be that that's the cultural norm. The language is such that we talk kinshipese, if you will, that this is what we do in the organization. So it really is about having that check and balance within the culture, the ethos of the organization, that people will feel uncomfortable with their bias, if you will.
Uh,
I know, Ricky, before you go to the next question, just from a data perspective, Dr. McDaniel, what's the current rate that your organization places with kin?
So about 70% of all children, I think is about going up to 75% in Allegheny County are placed with kin with our organization. In Philadelphia, it's about 62% and they're moving up. So, and we've had that for the organization is 32 years old. So it's not a new thing. It's been what we've been doing for a long time. And these are licensed homes. These are not, homes that children are just at. All these families are licensed and they're licensed using the same standards of our foster care system. We just really retooled it. So anything that's in the foster care space, we call it, we make it kinship friendly. But yes, oh,
Yeah, I
like
just
so
wanted
close to
to ask that
75%.
question because we do have 8 counties represented here.
Yes.
And when you hear, we know the national average is around 35%. From a county perspective, when you're at like 70, like that's definitely exceeding the national average, but it's also showing that a county the size of Pittsburgh can do this work so long as they're centering the right values and practices in place. So I just wanted to center that around the data piece, that you have the data also that speaks to the work that you've been doing for a number of years.
Thank you. And I think that's really important. We're a county administered system just like California. And so every county has a different way, but at the end of the day, the value, the language that you all share as the 8 counties is going to be really important in terms of what does that Kim First culture look like.
We've got questions popping up all in the chat, so I'll zero in on the next one here. This is from Jasmine asking, what methods do you use to create community and build rapport within your workforce? Burnout is a common theme we are seeing with workers, so any ideas to support and encourage them are helpful. And related to that, any specific interventions or tools you have to enhance the efficiency of kin placement, particularly for some of the staff for whom that might be proving challenging?
Right. So interesting enough, my first doctorate is it was in the School of Education and was really around looking at burnout, the antecedents of burnout and stress in human service employees. And back 20 something years ago, there was one article written on stress and burnout in human service and for child welfare workers. One. And where I had to find my data was in law enforcement and nursing and things like that. So I actually created a wellness program over 25 years ago for my organization. We have a wellness strategy that's been in place for 25 years because burnout is real. So I would offer for consideration that we have to think about ways in which in our human service systems that we create opportunities for stress reduction, right? And so what I did was and I know the counties may not be able to do this, but in some way figure it out. I gave 90 minutes a month that was free time that people could go and, have a gym on site. They could go out walking, they can go get their hair, whatever it was, they had to be able to do, they could identify it. And it was a thing that they did. I still have every Friday, I have 2 hours and it's online at this point where staff can go and get their wellness. So it could be a movie that we're watching around something around child welfare. We talk about it as a facilitated conversation. So we infuse that into our culture. So that's the first thing. The other thing around efficiencies, you got to look at some of those duplicative efforts. How many times do we have to ask the family their name? on 14 forms. We do the same, ask the same information over and over and over again. So how do we kind of make sure that the redundancies in our system are actually addressed and creating strategies to reduce those redundancies? I would suggest to you that if we could cut the paperwork in half, workers would not feel as burned out as they are. When we think about it in Pennsylvania, we spend about 60% of our time on paperwork. And we wonder why families don't have the outcomes that they have. We need to reduce the paperwork. We know we have all these unfunded mandates. How do we reduce that paperwork so workers can spend more time with families and we can expedite the front end in terms of licensing in a way with reducing some of those redundancies? And that's what we've been able to do.
Yeah, appreciate that answer. And I think another question that came up in the chat from Karen in Stanislaus County, it's something that we see often when we work with counties. It's navigating those complex family dynamics. So she asked, would you share what that very first conversation with relative caregivers should look like from the initial placement call? I think many are not aware of just how much of an impact on their life being a resource parent will be, especially initially, as it is so much more involved than parenting without child welfare. What are the most important initial supports we should address with kin?
So family engagement is really important. And again, I'm going to think about the standard of your own. How would you want somebody approaching you? Would you want somebody approaching you and saying you got 15 or 14 things? I'm going to use 14 now. You got 14 things to do. Or would you say, I need to listen more in this conversation. I really need to listen to you. Sometimes systems, when grandma's angry, like, oh no, she's too volatile. She's not a good placement. I want grandma to be angry because I need grandma to get out her feelings because she's upset that her daughter even has her in this situation. So why don't we look at that anger as strength? Grandma's emoting. She's really telling us what she feels. Once she gets it out, she says, okay, Sharon, I got it out of my system. Okay, now what do I need to do? So we really need to be able to listen more. We need to be able to understand that anger is a part of the process and not indict grandma because she was angry and she said, I am so mad. You maybe even use an expletive or two. We got to understand, give them that space. That engagement is so important. And when you hear her, you hear him, you hear their concerns and you say, well, how can I help you? We were in this situation right now. What is it that I need to help you with as we negotiate moving your grandchild here until your daughter is able to get herself on the other side of this? So it really is that passion, the compassion. You don't lead with your title. Please don't lead with your title. Please just say, I'm just here as a support, working with the organization, whether you're a provider or the county. How can I be of support to you? How can I be of service? I always talk about the inverted pyramid. When Greenleaf talks about the servant leader, you are the servant leader in this moment. So how do we become the servant leader?
Thank you for that, Dr. McDaniel. We've got a question here, circling back to what you shared about some of your personal experience with reviewing your case file later in life. And to the extent that you're comfortable sharing this, we have a question around, while you were looking into your specific case, did you see any positive intervention from social workers? What would you like to see have happened differently? Did anyone impact you, and how?
So they said I was smart. I think they thought I was smart. Oh, she's smart. She loves math. So those sorts of things, but it was very little.
Mm.
So what needs to happen is because families will go back and read their records, the courts, what we say, we also say in court. So what's in the record, we're saying in court. We're saying in family meetings and things like that. We're saying it everywhere. So what if we said something positive everywhere? And what if we said something about the opportunities everywhere? I wonder if we went to court and say, Your Honor, the opportunities for this family would be the following. Instead of saying, mom didn't do the following things and da da da. So the opportunity, what we found was there was a waiting list. And so while she went to the facility 3 times, there's a waiting list. And so that created a gap in her ability to get the treatment that she was required to do. So I wonder if we would tell that story. how families would feel, even when they're in court. So it really is reframing that. And that's what we need to do in the case record as well, is we need to be able to talk, the truth is the truth, but it really is through a lens of strength and a lens of, we talk about that family engagement. Families do better when they know that things are happening with them versus to them.
Thank you so much for that. As you're talking throughout, we notice a consistent theme about how important grandparents are to you and to your organization. And so we have a question from Darren in San Bernardino County, which is, how do you change a system that has a bias towards grandparents, that they're too old or unprepared to care for youth?
Again, you have the wrong leader. So part of it has to be that when workers are making decisions, if you vote, if there's a new leader coming in and people are asking you what type of leader that you want to have leading your organization, you have to use your voice. I remember when I was a caseworker and we were getting this new deputy and they were getting this person from Iowa. I was all of 23 years old and I said, why are you getting someone from Iowa to come to Pittsburgh? They don't know anything about our system. And so I said that to the director. I just didn't know any better. Okay, guys. I said, I'm going to use my voice. That person was there a year, and the director came to me and said, Sharon, you knew something that I didn't know. I was 23. I was not a director, but I knew something intuitively that Allegheny County is very unique and very different than Iowa. So we got to use our voices in ways that really just allows us to create the system that we want, we're desirous of. So don't be afraid to use your voices. We already know that there's some data that director or that person didn't work out. We don't want the same churn. Like, let us be able to be influential using our voices to say this is what we want. We can do that, guys. So I want you all to say, here are the things that would make my work life better. Say that to your supervisor. How do we do this together? Say, you all have administrative meetings. How do we do this? How do we create the culture that is desirous of centering grandma so we don't have the bias? And what's too old? Because you can't discriminate. People can work as long as they want to work. Try to say you can't work. You're going to be sued. So we shouldn't be using that type of language. So what is old? Because the new 70 is like the 50s. People are living longer. So you all need to understand. Listen, as the closer I get to 70, I'm like, yes, this is amazing. So you all need to understand people are living longer. They're doing more things. Life looks very different. So 70 is not the old 70. 70 is fabulous.
Thank you, Dr. McDaniel. You shared a bit about the experience and the data for Allegheny County, and we had a follow-up question around that, asking how are 70% of homes in Allegheny County licensed? So I wonder if you can share a little bit more detail and context around kinship placement and licensure in the Allegheny context.
Absolutely. Our families are licensed using the same, let me say that, same standards as the traditional foster care. It's just that we've reframed them. I created curriculum that we reframed it to be kinship friendly. When we were talking and working around the federal guidelines, I said we're not going to call them different. We're going to call it kin specific. I was very adamant about that language because we always think that kin is less than. And no, they're not. We have to train them differently because when grandma and mom are having a tiff, it's very different than a person who doesn't know you. So you got to negotiate those relationships. Those dynamics are very different. So that's why it has to be kin specific, because the child just left grandma's house. Grandma's now on the child is now in the family on a different level. Used to be the grandchild. The child now moves to a sibling level. So how do you negotiate where the grandchild now is on a sibling level, and then the other sibling, the mom's brother or sister, saying, well, would you have taken my kids in? So it's all those family dynamics that you got to work through that you don't work through in traditional foster care. So that's why it's different, and that's why it's specific. But the safety requirements, do we sleep in the same beds when we're little? Absolutely. How many of you all raise your hand if you did, right? So we got to think about some of those things that are not safety concerns. But at the end of the day, anything is around safety, they must, pass the test like everybody else. We look at the the backgrounds, but we're able to license our families in about 45 days. Why? Because we accelerated and we do trainings in home, group, whatever. We have to do, we call them enrichments. We don't call them trainings because grandma wants to be enriched. She does not want to be trained. So you got to also think about the language. When grandma's going to tell her girlfriend, I'm going to an enrichment class today, that's different than saying I'm going to have some tea out of training. So we got to think about the language again. And so they want to do that. We again, if grandma doesn't want to leave her home, we'll go into the home. So it's all about the culture. It's all about the framework that you're putting together.
Dr. McDaniel, I would be remiss because you just said something there that I think maybe went over some people's heads. If you all know about the kin-specific licensing standards on the federal level, kin-specific came from Dr. Sharon McDaniel. Just so you all know, she made clear to the feds that it needs to be kin-specific and not this other training. So I just wanted to give you your credit there. I know you probably won't do that, but
Thank you, Robert.
I'm
Yeah,
in
I
the
mean, I
know
think
to
it's
know that.
important because people want to make, that the kinship training, the kinship process is less than. No, it's not. It's just different, but it's kin specific. Thank you, Robert, for that.
Mhm.
Robert's always wanted to give flowers to folks, so we appreciate that, Robert.
Love that about Robert.
Yeah, I love working for him. That's why.
Yes, he's
Yeah.
amazing. He's amazing, guys.
um, kind of on that nuts and bolts kind of question about supporting kin. We had a question from Maria in Kern County about, from your experience, what funding strategies, policies, or supports have been most effective in ensuring that relatives are able to care for children placed with them?
Yeah, that's really interesting because people are so confused about 4E. As you go across the country, people are like, well, can you use 4E for this? Can you do all that? This is one of the last entitlements. And so for us, our county directors, they've been able to weave and bread those the funding streams together. But the other thing is for me as a private provider, I've gone out and get philanthropic dollars. And then sometimes, for me, because we have to run a support group anyway, do I care if a family that's not in the system comes to the support group? No, I'm running it anyway. So how do you leverage those resources to even go outside of those that are not in the system? You don't want anybody to come in the system that they don't have to. So if they can come, someone who's taking care of their kid in an informal situation, if they can get some information to glean to keep them out, that's what we're going to do. So you have to look at how do you leverage the resources? What are those other opportunities that might not we can tap into? How do we use CAPTA? How do we use 4E? How do we use all the things that are at the state level? And how do you bread those together and thread those together where you really have that robust system? How do we make sure that we're looking at Medicaid in a way that's robust? And I'm not necessarily expert there, but I work with people who know how to put that together. And I would offer, if you don't have someone who's an expert in financing in terms of whether state, federal, local dollars, make sure you tap into that person because we have, Mark Cherna, he's retired now, but he was masterful at finding funding. So you really have to get that funding guru to help you find those funding streams.
Thank you, Dr. McDaniel. And I'll flag for the group here that that is a topic that the Accelerator will be addressing and exploring and providing some technical assistance to the field on as we move later into the phases of the work. So appreciate you raising that. We have time for just a couple more questions, and we've got a lot of good ones coming up in the chat. So I'm going to raise this one from Jasmine in Sacramento County. Has your organization encountered issues with paternal bias in families? Do you have any advice on encouraging paternal engagement, especially in cases where fathers may be unknown or questioned?
So Jasmine, I say this respectfully, fathers are not unknown. It's just about who do we ask, right? I always say that if we don't engage the paternal side of the family, we're leaving 50% of the child's life on out there. Fathers must be engaged. We ask the question, who's the father? We ask mom, is there somebody on the paternal side of the family? So we ask the child if the child is able, because the child might have just been with dad or granddad last week. So we have to, again, that's one of those myths that fathers are not around. Fathers are around. I did a paper one time on the notion of absent fathers. And it was like, no, fathers are not absent. It's just because of the systems. If mom is living in subsidized housing, guess what? And if father has a criminal record, guess what? He can't be around. She will lose. So we got to look at the structural design of why fathers may not be right there. So we got to interrogate that and unpack that. But fathers are there. We got to ask the question, and we have to again push against the system that suggests that we don't look at fathers. The other thing that I did, speaking of that, when I started my organization, the Child Welfare Agency wanted me to put the per diem check only in the mother's name, only in the female caregiver's name. I said, absolutely not. If she was married, it was in both of their names. How dare I continue to perpetuate that behavior? So you really have to push against having males not be a part of that system. We need the fathers. We need male engagement.
I think one of the things that we are seeing in the chat is they really appreciated that enrichment versus training language. Folks are very much appreciative of that. And so, Nikki from San Diego had a question about how are there enrichments or supports that we should provide to kin caregivers that community foster parents would not need?
Absolutely. And I think that what you want to do is you don't want to be prescriptive. What I like is that you have focus groups, particularly because your area is very different. I don't know if it's a rural county or whatever. You want to make sure that you bring your caregivers in and you ask them, what do you need? What's important to you? You build your curriculum around what the caregivers need, not what you think they need. And so ours is specific to our communities. Philadelphia looks very different than Allegheny County. And then we have footprints in New Hampshire. So we're going to be doing support groups there. That's going to look very different. So you have to really be specific, but really get the information from your caregivers. But, one of the things that we do is just really negotiating an IEP. Grandma doesn't know what an IEP is and how to do something like that, or how to deal with the new math, if you will. So whatever the caregivers say that they need, how do you develop it? And support groups don't cost a lot of money at all. You get people to volunteer, you get teachers who are content experts in education. So you really just put a cadre of volunteers together to help you run your support groups.
And feed them.
And feed them, Robert says,
And
yes.
feed them. Feed them. Yeah, absolutely. You can have potluck too. It's fun.
Food brings people together like very
It
little
does.
else.
It
Yeah.
does.
All right, so I'm gonna wrap us up with our final question, and then turn it over to Robert to thank Dr. McDaniel, and then we'll transition to the next agenda item. So we have a question here. I would like, and you touched on this a little bit, Dr. McDaniel, but would love to hear a little bit more. They would like to hear how we engage the side of the family that does not have placement to ensure the child stays connected. So how do you support those connections with kin being maintained even when placement is not the appropriate or best option in that instance?
Yeah, that's a hard one for me because family, there's always a family member. There's always a family member, and it really is about assessing. But if it's so I'm gonna frame this a little bit differently because I'm not gonna default and allow our systems to believe that children can't be placed with family because they can. It's about the identification at the outset. So if in fact a child is in a traditional placement initially while you're finding family, then yes, what you want to be able to do is again, as I talked about that family engagement before, you want to be able to engage family. Johnny can't be here right now because maybe he's going to step down. Maybe he is in a group home. He's going to step down in a family. So how do you make sure that that family is going to see Johnny at the facility, right? That they're having visits, that they're having dinner together, all of those. So you're really stepping Johnny down into families. And we actually have a program stepping into families because we do work with young people who are in group care who's stepping into families. So you're really re-engaging that child and making sure that those connections, because guess what we know by data? Even when a child is adopted at birth, they go and search for their family because they want to know, where did I get these blue eyes from? Why am I short versus tall? So they go and get that information because they want to have that sense of belonging. So even though we remove a child DNA is stronger than any court order. DNA is stronger than any court order. So you all can remove and place with other folks, but that child will run away. How many of us know the children leave and they keep on running back to the family? Well, why don't we just try to figure out how to make the family work? Why we gotta trade? I don't ever get that. Like, let's work with the family because that's where they keep on running back to. So again, I'm going to say that there's a family, but while we're figuring this out, we make sure that we find that family, we ask that child, and then we do those visits. We make sure that we get those connections. We do those outings, those sorts of things. I think that that can happen. And so, same thing if there might be a respite care, you do the same thing. Children don't want to lose contact with their family. No matter what, children love their family.
Thank you, Dr. McDaniel.
You're welcome.
And I think we can take from today's masterclass so many nuggets that actually are not just what I call philosophical, but they are actually very concrete things that we can take within our own selves of how we can make a difference. Because what we find in participants today, we all serve at different levels. Maybe
Yes.
front line, maybe a supervisor, maybe an administrator or program manager. And the question we should ask ourselves is, what can we do in our own role? And I love this because we said this earlier. So much to learn here, but it's so much to unlearn.
Yes.
There's so much to unlearn. And I think as we begin to unlearn some of the unhealthy things that go counter to a kin first culture, we learn the things that gets us that much closer to achieving a kin first culture. And Dr. McDaniel, as you being our first expert to our inaugural masterclass, I would like to thank you for agreeing to do this. For everyone that's listening and watching, none of this was produced. We wanted it to be just a discussion, free flowing. Of course, we always have questions, but as you respond to those questions, it really helps to highlight other things, and hopefully there are things that you've heard, witnessed, and observed today that you can take back. I did see a question in the chat. Yes, this is being recorded. We will plan to ensure that you all receive it once we kind of go through the editing portion of it. But again, Dr. McDaniels, thank you. Want to give you the last word?
Yeah, thank you so much for the generosity of your time, the invitation to participate. I don't take these opportunities lightly. I'm very passionate about what I do and I'm very serious about what I do. I know that you all are working very hard to really, try to get this in a way that we're all proud of, that children are going to their kin first. And I just really appreciate everybody who's on the line and the incredible work that you're doing every day to make children better off and families better off forever, every day.